Alesse is a combination oral contraceptive pill containing both estrogen and progestin hormones. It is used for the prevention of pregnancy by inhibiting ovulation, altering the cervical mucus, and affecting the endometrial lining. Active substances: phenylestradiol, estrogen, levonorgestrel, progestin. Indications: Alesse is indicated for the prevention of pregnancy in women of reproductive age. How to use: Alesse tablets are usually taken once daily. The standard dosage is 1 tablet per day at the same time each day. The pack typically consists of 21 active tablets containing hormones and 7 inactive tablets, placebos. The first tablet is usually taken on the first day of the menstruation. Subsequent tablets are taken consecutively. It is important to take the tablets in the correct order and at the same time daily to maintain effectiveness. Contraindications: Alesse is contraindicated in individuals with known or suspected pregnancy, thrombosis or thromboembolic disorders, liver disease or impairment, hypersensitivity to any components of the formulation. Special instructions: If a tablet is missed, follow the package instructions or consult the healthcare provider. Additional contraceptive measures may be needed if multiple tablets are missed. A healthcare provider should be consulted for guidance if unprotected intercourse occurs, especially if multiple tablets are missed. Women over 35 years who smoke are at increased risk of serious cardiovascular events while taking hormonal contraceptives. Side effects: Common side effects of Alesse may include nausea, breast tenderness, headache, changes in menstrual flow. Serious side effects may include thromboembolic events and cardiovascular issues. Any unexpected or severe side effects should be reported to the healthcare provider promptly.